South Korea is seeing a sizable drop in the number of new daily COVID-19 cases, especially compared to a couple of weeks ago at the peak of this wave. But with a growing number of people still having symptoms after their recovery, the authorities have decided to launch an investigation into the long-term effects of COVID-19. Choi Min-jung reports.
South Korea's daily COVID-19 tally has dropped significantly. The country on Thursday reported 320,743 new COVID-19 cases, a drop of more than 100,000 cases from the previous day, and a whopping 300,000 cases fewer than at the country's Omicron peak 2 weeks ago. However, the number of critically ill patients is at a record high for the second day in a row, with 1,315 in critical condition. And there were 375 more deaths. Despite the current virus situation, the Wall Street Journal on Wednesday reported that South Korea could become the first country to transition to an endemic. It quoted U.S. infectious disease physician Monica Gandhi, who said this is mainly because the country has one of the highest vaccination rates among adults, high trust in the public health system, and the right tools to emerge from the pandemic. The journal pointed out that South Korea is at the leading edge of countries in Asia, despite cases for March hitting 3 times higher per capita than during the peak experienced in the US and the UK. As part of another effort to improve its pandemic response, health authorities on Thursday announced they will launch an investigation into the long-term effects of COVID-19.
There is not enough research on the long-term effects of COVID-19 worldwide. There is a limit to treating patients or managing the virus situation with the existing studies. This is why we need more standardized and accurate data on lingering post-COVID-19 symptoms to tackle the pandemic more effectively.
From the current studies conducted by local health research institutes and medical facilities, 20 to 79% of patients experienced fatigue, shortness of breath, and sleep and mood disorders after recovering from COVID-19. Around 19% have visited a medical facility due to such reasons. However, studies up until now are only based on those who are severely ill, hospitalized, or have underlying health conditions. To create more reliable data, authorities will be conducting studies on post-COVID symptoms on 1,000 patients. Choi Min-jung, Arirang News.